vitro fertilization has become one of the leading fertility treatments, but the higher cost of the treatment can sometimes become an obstacle for patients. Now, a new cutting-edge device is providing more opportunities for patients to undergo treatment at a lower cost.
There are a lot of different fertility treatments that are available for patients. There's just intercourse and trying, there's medications, there's intrauterine inseminations, and then there's IVF. And so there's kind of a big gap between intrauterine inseminations and IVF. But just this year, a new state-of-the-art technology has been developed called the INVOcell. So they're still undergoing the routine IVF with medications, but at typically a lower dose of medications. They undergo an egg retrieval where we retrieve the eggs, and then we place the eggs and the sperm in this little device called the INVOcell. The INVOcell actually functions as the IVF laboratory in essence. We place the INVOcell into the vagina for approximately 5 days and allow the embryos to culture. The vagina actually acts just like an incubator in our laboratory. It has the same environment that the fallopian tubes have, so it makes perfect sense to use this. The Fertility Institute of Hawaii is the first and only center in Hawaii to offer the INVOcell.
It's right this way. There's a couple of reasons why some people would choose the INVOcell. First off, it is a much more affordable procedure, and in many patients it'll yield the same success rate, especially in patients who are good prognosis patients, especially for women who are, for example, younger with excellent ovarian reserve. Their success rate with this device is going to be similar to traditional IVF. However, the cost may be about half the cost. Another reason is it does yield a more natural approach. Fertilization does occur inside the body. In addition, usually with this device, we do an entirely different protocol which allows for less monitoring, fewer office visits, less blood work, and lower dose of medicine altogether. And some patients really do prefer that sort of more minimal monitoring, less medical intervention, more natural approach.
In Hawaii, insurance will cover an IVF cycle if patients meet criteria. However, they only cover one cycle per insurance. So oftentimes patients are looking for a way to do another attempt if possible. And so the INVOcell is a perfect way to do that. The best way to find out information about it is just to discuss it with your provider. It's not right for everybody, but for patients that it is right for, we discuss that as an option.
This segment is sponsored by Fertility Institute of Hawaii.
Visit HiNowDaily.com for more information, and don't forget to follow us at Hi Now Daily on Facebook, Twitter, and Instagram.